Welcome, everyone. This is the Diana Wright Show. We begin right now. And of course, we welcome you to the show from around the world and in the United States. And we thank you so much for joining us. We promise to give you an hour of information and, inspiration. And of course, reading you uplifting words. And I will start this show with a quote from Gandhi. And I think this one needs to be written down. You need to write this one down because it's my message. I Love Me Crusade is my message. And I searched and searched. And here is Gandhi basically not saying I love me is what you need to be doing. But what Gandhi says is just similar. So it's a long, long journey of people wanting to know what they need to do for themselves. And Gandhi says this: our power does not lie in our ability to remake the world, but rather in our ability to remake ourselves. So how willing are you this evening to remake yourself? If you had some hate stuff in your brain by your mother, your father, your siblings, your relatives that told you that, you just couldn't achieve your dream, I'm here to tell you that if you are willing to remake yourself and begin by loving yourself and teaching your children to love themselves, you can and will be successful. Yes. So this is a good one. Gandhi was just, fantastic and great about the things that was said. And you can go back and find them. Sometimes they're difficult to find, but, I always want the ones that really inspire you. And I think that is inspiration. Just simply, you need to work on yourself. Don't try to change the world and have world peace and all that stuff. Look inside yourself. What do you need? What are you prepared to do for yourself come April 30th, which is International I Love Me Day? Our special guest inside the program this morning is, this evening. Wow, I'm still in the morning. Anyway, just reminding you that our special guest coming up in a few minutes, in about 5 or 10 minutes, is Dr. Melanie. And Dr. Melanie is a special kind of doctor because you don't find them very much these days. She's a general practitioner. So you can go to her for just about any problems or ailments that you may have. She is located right, of course, in Palm Beach. And her medical practice is called West Palm Beach Family Doctors, Inc. The telephone number, 561-434-5678, just in case you want to jot the number down, because you can call her tomorrow and ask her a question. Just tell her you heard her here on the Diana Wright Show and you'd like to get some stuff sorted out. So 561-434-5678, West Palm Beach Family Doctors, Inc. And we have lots of questions for Dr. Melanie. But before we go to Dr. Melanie, we'll know when she's calling. And she's normally pretty on time and prompt. So I just want to reflect a little bit about your day, hoping that you had a chance to actually look in that mirror and tell yourself how much you love yourself. Because if you didn't, I would like for you to do it this evening and join the crusade. Join the crusade. Tell everyone that you have in your Facebook genre, in your Facebook directory. Tell them about loving yourself. It's crucial. It's important. And as we move tomorrow morning to wellness, talking to Dax about wellness and taking care of yourself, losing the weight that you need to lose. Because, some people will say, I'm overweight, but I'm healthy. I don't know if that's even possible. Is that possible? Or are you taking a whole lot of medication to make yourself healthy or feel healthy? We have to think about stuff like that. And we just ask you to come on the journey with us and just celebrate yourself. Get out of too many people are depressed. Depression. How do you take yourself out of that place that you're in? And no matter how insurmountable your problem seems, I promise you, if you have hope and love, which are our 2 words for this week. Don't forget, last week we dealt with happiness, joy, and peace. And we move into hope and love for yourself, love for your family. Just do whatever you do, try to do it with love. Don't be mean-spirited. I listened to some of the justices today, and, I thought to myself, Chief Roberts, he said, what is it that these people want? Just a label? And I'm going, okay. Justice Scalia, he's always so mean-spirited. I mean, what he said about, affirmative action and just the Voting Rights Act the other day, and he just always seemed to be a man who has not come out of the 30s. I won't even say the 50s. He seems like he's still stuck in that 30s where people are talking about, I'm going to take my America back. I don't know what is a supreme justice like Justice Scalia. Every time I listen to him speak, it's never anything kind and loving and good. It always seems that he has something. Does he love himself? Justice Scalia, I'd love to know. Do you love yourself, sir? Are you telling yourself, I love me? And do you teach your children to love themselves? Because it seems to me that he spews so much hate and contempt for others that I just wonder, what is it? What is it? There is no way that one person can never have anything good to say about people from another race. It's just amazing to me when I listen to him and his voice has that mean-spirited tone. Justice Scalia, please, I am asking you to try to be gentler, kinder, and give some more love. Let us see the love that's coming from your heart. Let us not just see a man who is stuck in the 30s and let us think that you're racist, or let us think that you don't care about anyone else but yourself and your family. I gather he has a lot of children. So is he teaching those children to love themselves, or are they seem to be having that same bitter tone? I'm not saying that I would like to have my child be gay, but if they are gay, what are you going to do? Dump them? They're yours. They came from your belly, through your vajayjay. So what do you do with a child that is gay? Do you dump that child and act as if you never brought him here or her here? That can't be real. No one is condoning the sin that the Bible shows you in Sodom and Gomorrah. But why would we want to have people suffer? Because we are just so dogmatic and don't want to change. It's incredible to me. And I simply wonder why. Why is that? It's the same thing with Senator Portman. They were all against this thing with such vigor. Michelle Bachmann wants to repeal Obamacare. Is she thinking about the 40 million people that will be covered under Obamacare? And if they don't get covered, they'll be going to the emergency room as a doctor's office? What is she thinking? Why all this hate? Racism is at the bottom of it, I know that. But I thought that people, when they see the shooting at Newtown, when they see the shooting of Gabby Gifford, when they see the shooting in Colorado in the movie theater, don't you think that should actually change people and allow you to think that your days are numbered? You just never know when your moment and your number will be played. So why should we spend our time being mean-spirited and unkind to each other? I'm not saying Justice Scalia need to come over and have dinner at my house. But at least show some compassion. Show some caring. Show some love. Allow people to have hope when you speak. It's important. Because it does not do us any good for us to be beating down on others. Where does that put us? What does that do for us? There's some people who come into your life temporarily, or you just can't see on the same page, and that's okay. No one is saying that you have to love everybody and hug everybody and kiss everybody. Come on now. Okay, let's go to Dr. Melanie. Hi, Dr. Melanie, how are you?
Hi, I'm well. How are you?
I'm good, and you are always on time, and I appreciate that. Thank you so much for doing that, because you are prompt, always. I can look at the clock, and I know the phone is going to ring, and it's Dr. Melanie. So thank you for that. I appreciate it. Totally appreciate it. Welcome to the program once again.
Thank you for
And
having me on.
yes, and I have lots of questions, and I'm quite disappointed that you did not come on Skype. So because I want the folks to see you, to see who we're talking about.
Next week I'll be able to do that.
Okay, so so she promised to come back next Tuesday, and we will see her on Skype. Okay, she promises.
Yeah.
So, and you better keep your promise.
I will work on that.
Okay. All right. Welcome to the program again, as I said before, and I have lots of questions for you, but the first one I want to start with this week is an email that my husband sent me this morning, and I talked about it on the show, the early show, and it spoke about a new sign of recognizing that someone is having a stroke. And they spoke about the person sticking their tongue out, and if it's crooked on one side or crooked on the other side, that simply means they're having a stroke. Is that,
Right.
I mean, did you see the story? It came out this morning, actually.
So there's a nerve that innervates the tongue called the thyroglossal nerve.
Mm-hmm.
So what happens, I'm a little hoarse, so pardon me on that.
That's all right, no
But
problem.
that particular nerve, if there's a stroke on a particular side of the brain, so usually what happens is if you have a stroke on the right, your symptoms manifest on the opposite side of the brain,
Mm-hmm.
or the opposite side of the body.
Right.
So in the event that, let's say you had a left-sided stroke, then your tongue would deviate to the opposite side, so it would deviate to the right side. And often you would see that person is unable to control their tongue because obviously that part of the brain had an infarct or a stroke occurred.
Mm-hmm.
And so because of that, they're unable to control their tongue when they open their mouth. So they'll open their mouth, their tongue will protrude forward, and then it'll deviate, like I said, to a particular side.
Mm-hmm.
And not only that, many times you'll notice drooling as well once their tongue actually protrudes out of their mouth.
And the story is stemming from a gentleman and his wife who were at a picnic at a barbecue or something, and the wife was looking funny to him, and I guess he didn't pay enough attention, and ended up, when she went to the hospital, it was too late. So she died, and they said she had a stroke. So I guess, there was this cry today to get everyone to know and keep these things in mind. They spoke about also an S. They have STR, and they have ask individual to smile. So what would I be seeing before I'm asking that person to smile or test them to see if they are having a stroke, actually?
So for example, usually when you ask someone to smile, their face is symmetrical. So in other words, their cheeks are at the same level. When you look at them, their eyes are at the same level.
Right.
In terms of even asking them to frown if you suspect they may have had a stroke, because those are some of the signs and symptoms that we actually do to test the nerve that innervates the face.
Mm-hmm.
So when a patient or an individual, is likely suffering with a stroke, when they smile, you'll actually notice drooping of one side of their face. So their cheeks won't be symmetrical when you look at them. And when you look at their eyebrows, if you ask them to smile or frown, you'll notice kind of like one's elevated and one is not.
Oh,
So there's
okay.
some ways that you're able to tell that the nerves of the face, are affected because they suffered a stroke.
Okay, I am noticing that, on television, I see a lot of ads of young people. I see one woman saying she just had a baby, and 2 days later she had a stroke, and they're running these ads, and I'm wondering, are the people telling the truth? I hope they are. Because it's...
Say that one more time?
There are several commercials.
I heard you say about the ads, but you were saying, you had a question and I missed the question at the end.
Okay, the question at the end is that Are these people that they're using in these commercials actually real stroke victims? Because some of them are really young. And I'm going, ooh.
To be honest with you, actually, I don't remember the exact statistical number as of now, but I'll have to do some research on that again.
Right.
But there's an alarming rate of young people that are being affected by strokes now. Why? There's increased drug use, illegal drug use, especially crack cocaine.
Okay.
And that actually causes vasoconstriction or clamping down or tightening of the arteries. So you have decreased blood flow, which means decreased oxygenation to the brain, and these people can suffer a stroke.
Wow.
In addition to that, most people think they're healthy, so they never go to the doctor. And so many times, they have uncontrolled blood pressures. Why? McDonald's, Burger King, you know, all these fast food places, food is readily available, and we don't have to do the work of cooking. And so the salt content in these foods are high. And there's actually a recent publication that came out with the American Medical Association that talks about the fact that an alarming cause of death now is overconsumption of salt.
Wow.
So there are a lot of people out there that are consuming high levels of sodium or have high levels of salt in their diet, and they're really not paying attention to it. Why? Because a little salt here, a little salt there, the food tastes better, and it's really about what our taste buds crave. So people don't really pay that much attention.
That is the thing. They talk a lot about the DASH diet to prevent, or to, if you have high blood pressure or you are likely to have a stroke, the DASH diet is a good thing for you. That's the Mrs. Dash seasoning.
Yes.
Yes, but what are your thoughts on that?
The DASH diet, I mean, it's a good plan, but it's mostly for people who tend to be attracted to the idea of the DASH diet is those who usually are, you know, wanting to lose weight. Those are usually people that, you know, kind of seek after those diets. The average person, for the most part, would not go and decide, you know, they're going to have a DASH diet because everybody wants to eat whatever they want.
Yes.
But, you know, with regards to people who are diabetic, and, you know, people who are at risk of heart disease and stroke, etc., they usually recommend that kind of a diet because, you know, it's lower in terms of salt content. And, you know, the fact that it's been endorsed by, you know, the National Heart, Lung, and Blood Institute, you know, NIH, American Heart Association, you know, and all these other entities, the Mayo Clinic, you know, a lot of people are very attracted to that because, you know, it incorporates the idea of grains, fruits, vegetables, low fat, lean meat, fish, nuts, seeds, you know, things like that. Which overall is a good diet, but what about people who can't afford some of the whole food type of products?
Exactly.
You know,
what do they do? What do they do?
Exactly. So for those kinds of people, you want to provide them with recommendations that's going to fit their budget. So while they're trying to lose weight and while they're trying to be healthy at the same time, you have to take into consideration their portion sizes. And that's something we talked about, I think, my first time on the show.
Yes, exactly.
Was that a lot of times we eat much more than our body can even manage. Because we eat according to how we feel.
Okay.
And in many cases, we're already full of what they call satiety. And even though we're full, there's a portion of our brain that says, okay, stop eating. And then there's our taste buds that say, oh, this tastes so good, I don't want to wait until tomorrow, I don't want to wait until later. And so we try to compact all of that and force it down into our stomach. Well, your stomach, if you think of like a balloon, more air you put in the balloon, after a while, it has a maximum capacity and it can only hold so much. And after that, there's going to be an adverse effect. So whether you're running to the bathroom because you start to feel sick, you know, you're nauseated, you know, maybe you think stomach cramps or whatever the case might be, there's always an adverse, you know, event that occurs with overeating. And so, and not only that, when you overeat, you can't sleep.
Okay.
Your body doesn't have time to process all of that food before you go to bed because in most cases, people are always eating on the run. We're always busy.
Always busy. Well, the craze right now is that you should eat 4 ounces of protein in each meal and 4 ounces of vegetables. And whatever it is, it shouldn't be more than the size of your palm. You also mentioned that when you were here the last time. But it seems to me that people eat for different reasons. You mentioned emotions just now. And the fact is that when someone eats 4 ounces of fish or 4 ounces of chicken or steak or whatever it is, they're saying to themselves, I'm not full. And I keep saying to, like, my daughter, I keep saying, you're not eating to be full, you're eating to be satisfied. So if it takes you 3 bites to be satisfied, then you don't need to eat anything more. You know, and I think that feeds into our obesity problem, which is indeed a problem with young kids, especially going to school. How do you, when a young person comes to you as Dr. Melanie, and you're, you know, obviously they're overweight, what is your advice to that parent and that young person? Because it seems to me, you know, parents, yeah, you know, you can't really blame them all the way because they give them all this junk to eat at school anyway. When I went to school, Paviel's school, the first time when she went to public school, I could not believe what they were eating. I'm like, I don't even feed you that kind of stuff at home, you know? So what are you advising a patient who comes in with a young person? Should that young person, depending on their age, be going on a diet, be put on a diet, or because they're too young, you don't recommend that?
So, you know, there are many recommendations that are given about, you know, how we should eat. And one of the big things is we do not consume adequate amount of fruits and vegetables.
Right.
So roughage or bulk is a big part of the diet. Why? Because it allows your digestive system to function the way it should. But for a parent that comes in and their child, obviously, by just even physically looking at them, appears to be obese,
right?
Separate from calculating their body mass index, which, you know, is in relation to your weight and your height,
right,
and what you appropriately should be for that age group, it is quite alarming when you have to deal with parents who their idea is, well, they can eat whatever they want. I buy it, they eat it, and I don't see what the problem is.
Wow.
Doing well in school, they're functioning, they're sleeping, who cares? Eat whatever they want. Oh. Well, it may be okay, or so it would seem for right now. However, there's some children who do not gain stature or do not grow any further. And whatever baseline height they are when they present at that time, like let's say, you know, your average 13-year-old. Right. Usually most boys and girls have a growth spurt around 13, but there are some that whatever height they are when they presented at 13, that's it for the rest of their lifespan. Oh. You know, and so you have to look at what the family dynamics are. So if there are risk factors in the family, such as high blood pressure, stroke, diabetes, you know, hypertension, things like that, you have to take those factors into consideration because a child, when you look obese and you check their blood pressure and, you know, their target blood pressure is set by the Pediatric Association for Children. And if they're not at that target blood pressure and their blood pressure is obviously elevated, then that's a factor now associated most likely with their obesity. And it's very difficult for children to lose weight in some cases because they're not able to be as physically active. Right. So they may walk a block or even a quarter of a block, or they might be in PE, for example, and they start complaining of being short of breath. Maybe they start wheezing. You know, these children develop asthma. And not only that, their bodies are not able to keep them upright for very long because now you're putting pressure on your spine and on your large joints, so your hips and your knees take the brunt of your weight, the more weight you start to put on. And so not only that, their self-image becomes affected. So you have to, you know, when parents come in, I have to counsel parents from all angles. I say, you know, you might think it's okay and it's not a big deal and this is your child and, you know, they have no other problems. They're a good kid as you would describe it. Yes. But you have to look into their future. Okay. They're not looking into their future. You, as the parent, have to look into their future. And you have to see. And even sometimes you have to interact with them and say, well, how do you feel about yourself being at this current weight? Would you like to be, like your friends more active or whatever the case might be, and not, be busy sitting down watching video games or playing video games all the time?
The computer.
Or active. Because, most of us being from the islands, we knew what it was like to be outside until dinner time. You get called to come inside because you were so busy playing.
Right.
That's not the case now.
Mm-hmm.
That's not the case now.
The computer is killing our kids. I heard Steve Jobs' doctor talking about, weight on Fareed Zakaria's show about 2 weeks ago. And he simply said, look, we're sitting too much and we're killing ourselves by too much sitting. Get up.
I love that.
He was I was like, okay, I love you guys.
He is absolutely correct.
Yeah, he just believes that people need to move. It's not, sometimes it's a food, but they just need to get up and move. And people are just not moving. Okay, I want to take you back, Dr. Melanie. And first, we just want to remind you that our special guest inside the Diana Wright Show this evening is none other than Dr. Melanie. This is her second visit to us, and her practice is West Palm Beach Family Doctors, Inc. Her number to call her, just in case you want to find out any more details than what I'm asking, 561-434-5678. That's 561-434-5678. And remember, I told you that she's of a breed that's dying. She's a general practitioner. So you can actually, in those days when you go to the doctor, you only have one doctor and he can fix everything. And she is the person. I didn't even know that they existed anymore until I started speaking to her. So it is such a breath of fresh air to know that there's still a general practitioner that you can actually go to. And what age group does your practice start from and end at, Dr. Melanie?
From the cradle to the grave.
Oh, from the cradle to the grave. Okay, so anybody. Okay. All right. I want to go back a little bit to the stroke, because the next thing they had here was T. Ask the person to talk and speak. So,
correct.
What are you looking for when you're asking the person to talk? When they're actually having a stroke? What are you looking for?
So usually when someone is communicating with you, usually they have what you call fluency, or their speech, it just kind of rolls off their tongue, and they're able to communicate with you in a way that's comprehensible, so you can actually understand. Like I'm, having a conversation with you right now in our radio audience, or our TV audience, and as we're communicating, they're able to understand me clearly, unless for some reason, they might be muffling some technical difficulties or something. But whenever you're communicating with someone, they should be able to communicate with you in a way that's, comprehensible. So if someone is having a stroke in front of you, for example, their speech becomes slurred. So rather than their words coming out as they normally would, their speech can become slow.
Wow.
As well as it can become, slurred, or they might not even be able to communicate at all.
Right. Okay.
It could get that serious where they're not able to communicate at all. Because some people have had bilateral strokes. So instead of just one side of the cerebral hemisphere of the brain being affected, both sides get hit.
Get affected. Okay. All right. The next one is, R. Ask them to raise both arms. I would never have thought of that.
About raising their arms?
Both arms. Yeah, I would never have thought of that. I mean, I kind of, it's kind of logical about the speech and the tongue, but I would never have thought to ask someone to raise their both arms. So what does that exactly do?
So, with regards to the arms, you actually can have weakness that occurs with a stroke. So they call it hemiparesis. And hemi, of course, means half or one side.
Right.
So a person, depending on, which side of the brain, if not bilaterally, gets affected, they'll actually be unable to really hold their arm up without assistance. It'll just kind of like, if you can just imagine me holding my arm up and it just falls down because of the weakness that has occurred on that side.
Okay. All right.
So there are different areas of the brain that can be affected with regards to the presentations that people can present with. So in some cases, there are various arteries. So there's a middle cerebral artery, posterior cerebral artery, anterior cerebral artery. So depending on which area of the brain gets affected, their face and their arms could be affected pretty significantly in some cases. Some cases, it's arms, face, legs, so different areas of the body that can be affected. But, weakness is a big sign that somebody most likely had a stroke.
Right. Okay. All right. So let's kind of recap for people. If you are with someone and they seem like things are not going so right, you need to, what would be the first thing that you would look for? Because I see that they have it in some kind of order, but I'm not sure. Are you asking them to stick their tongue out first, or are you asking them to speak first or smile first? Where would you start if you actually notice that someone you're with kind of seem a little funny?
Well, here's the other thing you have to consider. You have to consider that the person may have had a seizure.
Okay.
Because the seizure may not present where there's foaming at the mouth.
Right.
There's some people that their seizures occur where they give you a blank stare. It looks like they're looking straight through you, and they're not communicating with you at all. So that's the other thing that you have to consider is a potential seizure may have occurred.
Okay.
So,
So there's a big difference then between a seizure and a stroke. Is that
so
what
a seizure is you basically have decreased oxygenation to the area of the brain, similar to a stroke, with the exception that with regards to a stroke, a stroke can lead to a seizure. But the idea is that when you suspect that someone may have had a stroke,
right?
Usually trying to communicate with that person usually is the first thing that most people do. Because some people may have had a stroke and how they present, they pass out. So that's the other thing, they may pass out.
But isn't that, if you're with someone and they're probably having a stroke, you're panicking. So, because actually I was watching a movie and the woman was having a heart attack or something, and her daughter, instead of calling 911, she called her brother. And I thought to myself, she called her brother instead of 911. And I thought to myself, is she crazy? And she kept holding her mom, and you could see, it's a movie, so they're showing you all the symptoms that are going on. And it dawned on me that, why is she doing that? So by the time the brother got there, he's saying to her, stop screaming, call 911, and she's there panicking because she is figuring her mom is just dead. Yeah. So, I wonder sometimes the reason, because the husband that had the experience that they really focused on this last week at the barbecue, he just didn't know what the symptoms or the signs were. He just saw his wife. She was there eating barbecue chicken or whatever, ribs, I think. And he just noticed she was acting funny, and, he was lost, basically.
Right.
Yeah. So how do we because it's just like when you're told that you should learn basic things about, if someone is drowning and you take them out of the water, what you should do mouth to mouth and all that. But no one teaches you about, what signs to look for, especially if you have a parent or a husband or a wife that's older or whatever. I know there's no age limit to the whole stroke thing, but why is it that we're not being made aware until this big thing happened? What are we supposed to be looking for?
It's funny you asked that question. I think a lot more people, obviously with Dr. Oz being on, a lot more people are tuning into, things as far as health topics are concerned.
Yeah.
And, I commend him tremendously for the wonderful job that he's doing, because it's heightened the population's attention to paying attention to simple things that you can do to help sustain your own life.
Right.
And with regards to the alertness or awareness being made with regards to paying attention for someone having a stroke, it's very important because, you could be in any unfortunate setting where you have to be the person to provide assistance, and not knowing what to do can be harmful.
So basically then we need to just educate ourselves if we live with someone or we have parents or, that are older or whatever. So we actually are aware of the signs that we're looking for. That's what you would recommend.
Yes. Yes. Okay. And I mean, it sounds simple enough, but, always pay attention to how people sound. Because, I mean, just in having a conversation with someone, you can tell what kind of mood they're in based on how they respond. So just similarly, while you're feeling out what their mood might be, you can check to see if their speech has changed at all. Sometimes you can just, be silly in a conversation and say, "Oh, I would love to see you smile."
Okay.
So if you notice something kind of odd, you can say, "I would love to see you smile," or, tell them something funny and see if they laugh or respond. Or you can say to the person, if they look uncomfortable, you can say, "Are you feeling any kind of pain? Does your chest hurt? Is anything going on? Are you having a headache?" Because another big thing that people present with many times before having a stroke is a severe headache.
Headaches, okay. Wow.
A lot of people will just say, "I have a headache," and think nothing of it, and the next thing you know, you heard that so-and-so is in the hospital because they just suffered a stroke.
So the thing about hunger headache is not real? Because if I don't eat all day, at 4 o'clock or 3 o'clock, if I'm fasting, I am having a headache, and not a severe headache by no means, but I feel my head going, okay, I think I need some food or something hot.
A hunger headache, funny you said that. A hunger headache presents quite differently in many cases, because most cases with hunger, you also, people tend to have, gas pain kind of going along with that.
Right.
And I mean, your body obviously, and if you're hungry and your head starts hurting, the best idea is to listen to your body and put some food in it. Whether you're getting a hot beverage or something to snack on or whatever the case might be, paying attention to that particular symptom, is necessary. But headaches in general are something that become very concerning because, you might have a situation where, for example, a sickle cell patient is at risk of having a stroke. Like, someone that has full-blown sickle cell disease is at a high risk of having a stroke because they're always having what they call micro-infarcts occurring because the sickle cell is kind of like a half-moon shape and is trying to pass through the vessels, the blood vessels, and as it's doing that, when it gets stuck, it causes what they call an infarct. So, that's where their bone pain and everything else comes from.
Right.
And so, as they're having that same infarction occurring in the brain, obviously, they're having a stroke. So, their risk is even greater. And, you were talking about, I think you said someone was pregnant.
Right. Yes, a young lady. The ad is run very often on television, and they're obviously advertising Bayer aspirin. And she said she had her daughter, and everything was fine. And 2 days later, she had a stroke, just like that.
Right.
And she looks like a young woman.
Pregnant women are very hypercoagulable, as they call it.
Okay.
So their risk of having blood clots, a stroke, it's so high. And not only that, their body level, as far as their cardiac output, their heart is working harder because they're pregnant.
Right.
And that's why they always, warn pregnant patients to maintain good blood pressures because they can go into what they call preeclampsia.
Eclampsia,
where,
yes.
They can they can have, liver failure and things like that, and they can also have seizures.
Right.
So their risk is even more heightened because of, a beautiful thing, which is being pregnant, puts them at risk of having a stroke.
Okay. All right. Well, our special guest inside the Diana Wright Show Live is Dr. Melanie. And Dr. Melanie is a general practitioner, very rare breed, but she has her office at West Palm Beach Family Doctors, Inc. Her telephone number, 561-434-5678. That's 561-434-5678. So we ask you to give her a call if you have any more questions. Next week, we hope that she'll be going by Skype, so the phone will be free, so you can call and ask your own questions. And I have I just want to do a wrap up of what Dr. Melanie just said. Signs of a stroke. Someone around you is having a stroke. You need to ask that individual to smile, ask the person to speak, to talk to you, and ask the person to raise both arms, and then of course the tongue, which is what they came out with today, saying this is a new way. If the tongue is crooked to one side, you better beware. So, a lot of us have aged parents, and a lot of us are getting older ourselves, so we just got to be mindful of this. And headaches are a sign of also not the hunger headaches that I'm talking about. Is that headache you're talking about, Dr. Melanie, a severe headache, or is it just...
Usually someone who is suffering a stroke, they usually complain of a significantly terrible headache.
Okay.
So it's not the usual, you might have history of a migraine,
right,
or let's say a sinus headache or something of that sort. No, it's usually a pretty intense headache.
Okay.
All right. They might complain of visual changes like blurring of their vision or other things with that. It's a pretty intense headache.
Okay. All right. I want to talk to you about something that I heard on television, because, you do the babies from the cradle to the grave. So I want to talk about solid foods, because I heard a story this week, I think it was yesterday, and they're saying that a lot of mothers are beginning to give their children solid food at 4 months, saying that they want it. And doctors, the recommended time frame is 6 months. But a lot of mothers are saying the kid want the food, and, doctors are saying this is something that can encourage obesity and also eczema. What are your thoughts on that?
Okay, I just wanted to make one correction for the prior discussion that we were having. Nerve for the tongue is the hypoglossal nerve. I think I called it something else.
Okay. Well, that's a big doctor term, so I did not absorb it.
Yes, hypoglossal.
Okay.
But yes, with regards to babies, it's usually recommended that you don't introduce solid foods until around 6 months. Why? Because children, number one, they're picky eaters.
Right.
I mean, even though, they're babies and they don't really know too much of what's going on, to some degree they have an idea, I want this or I don't want this at all. But not only that, they can develop food allergies.
Right.
And that's another big concern when you introduce, food that early in their life. And so around the 6 month age group is usually the most recommended time. Because at that time, they will have built many antibodies by then, and their body is more able to tolerate, trying many different kinds of fruits and vegetables and things like that. And of course, most people do beet nut stages. And for people who cannot afford beet nut stages, they do their own puree version of, fruits and vegetables that they would like to feed their babies.
Are mothers supposed to be taking the shortcut of just buying bottled foods and just feed that to the kid, or are they supposed to be trying to do it themselves? I mean, it's a lot of work, because I did it. I didn't buy bottled food, but it was a lot of work, trying to do this.
Well, it goes back to what you think is best for your child, and also, I mean, obviously with the pediatrician or general practitioner's advice, what you would do for your baby. But you also have to take into account time constraints and economics. Those are big factors, because a lot of people would like to have, the peas.
Peas,
they
yes.
would like to feed their babies, or peaches, or whatever the case might be. But for some people, it's a lot easier for them to get it themselves and do their own blend and feed it to their baby.
Right.
So economics and time is a big factor, because, and then the other thing that people forget is sometimes you can pre-prepare these foods and have them available to feed to your baby. But many cases, everybody wants to do it fresh right there, right then. So in many cases, they'll, for a lack of time, they'll say, well, I'll just have to get this pre-prepared in advance, and then I'll be able to feed that to my child. But it just really depends on the individual.
Okay, so for a child my daughter was allergic to every single formula. There was none. I mean, everyone we tried, she just would not take it. And, I had to pump and fridge and then feed, because she wouldn't take that either.
Right.
So what is the recommendation now? Because I see a lot of mothers are trying to breastfeed their sons and daughters until they're like 4 years old. And I thought, woo, that's a little old, don't you think? Is that too old to be breastfeeding?
To be honest with you, I cannot imagine having a child latching on to me for that extended period of time. No.
Okay.
I don't think it's wise. However, I do not turn my nose down on parents or moms who choose to do that.
Mm-hmm.
But, up until about a year and a half, 2 years old, I can understand, but what do you do when you're not producing adequate milk anymore and
Right.
that child still desires breast milk?
Mm-hmm.
That can become a huge issue. So, and not only that, we're trying to introduce them to whole milk, which you should not do really before a year old because of the fact that there's an increased risk of anemia in children when you do that.
Right.
And plus the risk of an allergy too. For mothers who say, this is my body and I can do whatever I want to my baby and I'm going to do what I think is healthy. And, not only that, they may grow and they may function, but they may not get all the nutrients they need because in some cases the babies or children only want breast milk.
Okay.
They don't want vegetables. They do not want fruit. You know what I mean? So you don't really provide a variety, if you will, in that meal setting when you're only doing breast milk until they're 4 years old.
Okay.
And there's some mothers out there that they can honestly tell you, my child will eat nothing other than me pumping. That's it.
Wow. Okay. All righty. So for those of you who, want to do the breast thing, then go for it. Anyway, I want to move now from babies, and I want to get into autism. Last week, there was a big report and scare among a lot of people. Instead of 1 in 100 who are autistic, it's now 1 in 50. So, and everybody's trying to come up with various reasons for why this happened or why it's happening. Would you have any information to give about or advice to parents to signs to look for in a child that is autistic? Because it seems to me now 1 in 50, that means everybody seems to be autistic. That's a big number.
It is huge. And a lot of people will hear, 1 in 50 or 1 in 100 or 1 in 1,000 or 1 in 10,000 or 1 in a million. Mm-hmm. And, they might not think anything of that statistic, but when you're the one or your child is the one, I think it's 100%.
Yeah.
And so that's why you have to pay attention in settings like that because, it can be your family that gets affected by this disorder.
Right.
But usually what happens, obviously it's a developmental disorder.
Right.
But some people attribute it to be dietary changes, digestive tract changes, vaccine insensitivity,
yes.
or sometimes, they'll say that it has to do with the child not being able to the body not being able to properly utilize vitamins and minerals, etc., why a child becomes autistic. But the biggest one that most people link with autism is vaccination. And so a lot of people, in many cases, refuse to have their children vaccinated. However, majority of schools will not accept a child into the school unless they're vaccinated. Why? Because you put other children at risk, and not only that, you put your own child at risk by not giving vaccinations. But to kind of go back to the idea of autism, usually you have social development that's occurring, cognitive development that's occurring in a child, and usually autism is diagnosed by about 3 years old, where the child tends to be kind of aloof, or another word for that is they're to themselves. So they're not really very interactive. They're not really, into the idea of communicating, and they might just sit and stare for hours at one thing.
Okay.
Or just be engaged in one activity forever, as it would seem, and not be very interested in socializing, whether it's with their family or friends or other children or whatever the case might be. And so obviously a behavior like this is very abnormal.
Okay. I'm thinking now because part of the research that came out last week when they gave this 1 out of 50, big number, they were saying that men who are older, who have children when they're older, or all the way to your grandparents, they're the ones that are contributing or maybe contributing to a child being autistic. But then there's another doctor who said, not so fast. There are several variables that make a child autistic. So don't just go be blaming the old dads or the grandparents. So there was several school of thought. What are you seeing? Are you having patients that are indeed autistic? It is that big, or is it not, something prevalent in your practice?
It's not prevalent in our scope of practice. I have encountered children who are autistic, and over the last several years, that may have been 3 at the most.
Oh, okay.
That I've noted. But
Okay.
I personally, because we do serve the pediatric population, but we do not have a large pediatric following.
Okay.
So, we don't really have that experience too much as far as that's concerned.
Right.
But there's some people who are normal, some children who appear normal by about age 1 to 2, and then all of a sudden they lose language or social skills that they previously had.
Right.
So the verbal and nonverbal communication, the social interactions, and the pretend play, are things that you would kind of notice. It's like they always tend to have an imaginary friend. And it's not that children
Imaginary friend.
But this imaginary friend never seems to go away.
Okay. So if your child is having an imaginary friend, you need to kind of watch out? Is that what it is?
Not necessarily so, because it's good because it helps them with their development. But if your child is nonverbal,
Right.
that's very concerning.
Okay.
Or their developmental skills of language is slow or not at all, or they just gaze and stare at objects, that nobody else is paying attention to. So, let's say, for example, we're at a pool party and everybody's paying attention to the person that's doing barbecue because, they're calling for everybody to come and get a piece of chicken or corn or whatever.
Right.
And this child has no interest and sits in a corner by themselves and could care less that anybody's even at this party, much less themselves. You have to kind of watch out for that, especially when there are other children of their age group that are present and that are engaging each other and they're not doing the same thing.
Okay. All right. Great advice. So we're going to move from the cradle now and we're going to get to menopause. Why on earth is no one teaching young women about menopause? Because you get to 40 or you get to 50 and boom, here you are with this thing, hot flash, and you are going, what? What is this? Why is it that the medical community or our parents, or I don't know who to blame, okay? How are we not learning about menopause? Because a lot of young women now are having menopause.
Well, funny enough, with regards to menopause, there are a lot of people that are experiencing early menopause. It could be genetic, where obviously based on family history,
Right.
you enter into menopause at an earlier age, and usually menopause takes place around 50 or so, give or take a couple more years.
Right.
But women who experience menopause, in some cases 40. But when you start to get the progression of the hot flashes and the mood swings, the irritability,
Yes.
the night sweats, things like that, it alerts people. But the other thing that people forget, their diet.
Okay.
Your diet can produce some of these same symptoms.
Right.
Yes, your age contributes to it. And of course, as we age as women, our hormonal levels as far as estrogen start to decline. But it's a steady kind of decline that occurs. Of course, you can enter menopausal enter menopause a lot earlier in the event that you had a hysterectomy for, let's say, uterine fibroids.
Okay.
You might enter a menopausal stage a lot earlier if you had to have a procedure like that. Your earlier years, or if you had cancer for whatever reason and you had to have your uterus removed, that it can preclude you to having these symptoms at an earlier age. But overall, in the medical community, I would say that the percentage of women now who are going through menopause is still about the same average age, which is about late 40s and kind of beyond. that
Okay.
most women actually complain of,
Okay.
their menopausal symptoms. But like I said, diet has a lot to do with some of the symptoms that women are experiencing.
Right. Okay. And of course, you need to educate yourself about menopause. Now, my question to you before I do that, I just want to remind people, welcome to the program. This is a Diana Wright Show. My special guest is Dr. Melanie. And Dr. Melanie is a GP, a general practitioner. Her office is located at, or we didn't give the address, but anyway, her business is called West Palm Beach Family Doctors Inc. Her telephone number 561-434-5678. That's 561-434-5678. And I'm not giving you the address because I know most people, if you're going to want to see a doctor, you're going to call. You're not going to try to figure out the address. You're going to wait until they tell you. So I wanted to ask you, does menopause seem to have an end? Because some women just seem to have it eternally. It just never seemed to end for some women.
Menopause does have an end.
It does?
And that end for some people is when they're dead, unfortunately.
Wow.
Death is kind of the end point for some women. But, I mean, menopause, it's a continuous process pretty much after the cycle stops. And usually women will have irregular periods
Right.
for about a year. Some cases even up to 2 years before they completely go into full menopause. But the symptoms, like I said, because you have that decrease in your estrogen levels, those symptoms, I mean, unless you're taking estrogen supplements, in the case you have a family history of breast cancer or a gynecological cancer of some sort, where it would be contraindicated to be on estrogen therapy,
Right.
then you are most likely to, unfortunately, be symptomatic. And in many cases, there's some people who take natural products, like black cohosh,
Right.
to help them with kind of eliminating or minimizing these symptoms, if you will.
Okay. All right.
But
Well,
unfortunately, there is no clock that says when you get to this particular age, you will
Right.
no longer experience these symptoms.
yeah. And the reason I asked that is because I read, when I got to be 40, I started reading all these books because I'm just one of these crazy research kind of person. So I read several people's books, women and doctors and whatever. And it seems that they all were kind of saying that, by your 65, you should kind of not have any more symptoms. But I know lots of women who are over 65 and they're still having hot flashes, Yeah. So,
I actually met, I'm going to call her a young lady because she appropriately calls herself that. And with all due respect, I would say the same. But I actually met a young woman who was in her 70s.
oh,
And she said that, she had had a hysterectomy for obvious reasons of dysfunctional uterine bleeding. And she has continuously experienced menopause since late 30s until currently in her 70s.
my.
And then there was another woman I had the pleasure of meeting because I was actually giving a talk about menopause. And this particular woman said she started in her 50s. And at the time I met her, she was, in her mid-60s. And she said she never experienced menopausal symptoms. Her mother's never experienced it. Grandmother's never experienced it. So she doesn't know why women get so worked up because she doesn't see what the big deal is. She's not on any kind of supplementation or anything. And she says every now and again she will sweat, but it's nothing like, what these, according to her, women are complaining about.
Well, I've actually seen women though who are sweating until their clothes are wet. I used to work with a woman in New York when I worked for Bar President of Queens, and Miriam had to have a fan on her desk constantly, no matter whether it's winter, summer, or fall. And she always had to bring an extra set of clothes because she will sit there and I will just hear her burst out. Oh my God. And when you look at her, she is wet, soaking wet.
Wow.
Yes. So I've seen so many different degrees of it. I know some women, they'll be just out at a party or whatever and they just start sweating. And it's like they're embarrassed because they're fanning and everybody else is cool. So I just wondered if there was a cutoff date, or, is it something that you just hope and pray that you don't get until you're very old, because it can be quite annoying. I know one woman when I lived in Coral Springs, she lived in Parkland, and she had menopause so bad that she became so depressed she would not come out of her house. She could not even go to her grandchildren's graduation. It was that bad.
Wow.
Yeah.
And that's very unfortunate.
Yeah.
That's an extreme case, and that's very unfortunate. But unfortunately, there are quite a high percentage of women who do experience just that, which is severe depression because of menopause. Because, when they're going through the night sweats and they're always constantly hot and they feel embarrassed because they need to change their shirt, or they're unable to sleep, so they're not getting adequate rest, and so they're fatigued and they're irritable and everything else that goes with decreased sleep,
right.
And they are unable to concentrate. But, of course, that affects many other areas of your life. And in some cases, people become very antisocial.
Yes.
And not because they want to be antisocial, but unfortunately, because of those particular symptoms, they're not able to handle it very well.
Right.
And in many cases, they don't want to be ridiculed. For example, you go out with your girlfriends to the mall, and everybody else is there, trying on clothes, and let's say you go try on clothes, and instead of needing to try on clothes, you need to take a shower before you try on something.
Yeah.
That's being case, but that does happen to some women.
Right. Okay. All right. Our special guest inside of the Diana Wright Show live right here this evening. Wow. Lots of information that we covered today. We are almost out of time, but before I go, I'm going to let Dr. Melanie know that the next time she comes back, we're going to be talking about autoimmune diseases. And I'd love to be talking about deafness in babies, because I've had an experience with a family member who the child was 5 years old and she didn't know the child was deaf. And they had to tell her at school that her child was deaf, and I'm going, what? This is just absolutely crazy.
Her child was?
Huh?
Oh, I missed what you said with regards to, you said her child was
5 years old before she realized, and she didn't realize it. The teacher at school made her aware that her child was actually deaf. And
was unable to hear.
Yes, total deafness.
That's what I thought you said. I wasn't sure. I was just trying to make sure.
Right. Yeah. So we're going to talk about that next week, and I would love to talk about sleep, because sleep deprivation is so prevalent among young people, old people, middle-aged people. I don't know. And nobody seems to escape this sleep thing. And also hysterectomies, and also I'd love to get into some of those issues next week, and fibroids.
Okay, so let me just backtrack. Okay, so autoimmune diseases, sleep deprivation, uterine fibroids.
Mm-hmm.
Okay.
Mm-hmm. Okay, so we want to talk. I want to just let everyone know that that's where I'm gonna go when you come back as our guest, because I really want to talk about hysterectomy, and I truly want to talk about sleep and fibroids. Fibroids seem to be plaguing women of all ages. I just spoke to someone a couple of weeks ago. She is like 31, and she's filled with fibroids. What's going on? Is it the food? What are we doing wrong? And then sleep, of course, and autoimmune diseases and deafness. I just want to leave that for next week when you come back with us, and hopefully we can get some other questions during the week. Some big other health news will come, and I will throw it at you next week. So thank you so much, Dr. Melanie, for joining us this evening.
It's my pleasure. Thank you.
Yes, and thank you so much for educating us and giving us the tips that we need to make our lives better. Diet. It comes down to diet. I notice you stress diet a lot, and that is really important. So I note that, because every time you're on, you talk about diet. You have to watch your diet. All right. Okay, Dr. Melanie, have a great evening, and thank you so much for joining us. Okay.
Thank you again.
Take care. Bye-bye. All right. That was Dr. Melanie. What a lot of information she gave us. And I told you what I need to talk about next week, because obviously I have it all written down here, but I could get to it. It's only an hour. So, and next week, hopefully she'll be on Skype, so you'll be able to call and ask your own questions. Just in case you would like to call Dr. Melanie, the name of her office, West Palm Beach Family Doctor Inc., And her number, 561-434-5678. That's 561-434-5678. And she is a GP, a general practitioner. What a rare breed they are these days. I didn't even know they existed. Everybody has a specialty. Your nose ache, you got to go to the nose doctor, the ENT. You have an issue with your vajayjay, you got to go to the gynecologist. You have a heart problem, you got to find your internist kind of, helps that, but you need a cardiologist. So there's so many specialties, podiatrists. I mean, I can just go down the list. And who knew there were still general practitioners in Florida, in West Palm Beach. I don't know if there is anywhere else, but I just believe that she's quite rare. So Dr. Melanie, our special guest, and we hope that when she comes back next week, you can join us again and get some more information. And you can either text, email me some questions that you want me to ask her at dianawrighttv@gmail.com. You can go to my website and tweet me your questions. You can also, of course, send your questions through Facebook. And we thank you so much for joining us this evening. Don't forget that if you love something, set it free. If it comes back, it's yours. If it doesn't, it was never yours. Tomorrow morning at 10:30, we welcome again our special guest, Dax Dunn from Rad Wellness Center in Plantation. And he will be here to talk about wellness again. We're going to talk about gluten. We're going to talk about wheat. We're going to talk about a lot of things tomorrow. So do join us. And of course, we hope that you can tell a friend, love us on Facebook, give us the thumbs up, and tweet us. And of course, the number here, just in case you have a question that you'd like to ask Dr. Melanie when she returns, 561-228-1921. That's my number, 561-228-1921. Once again, thank you so much for joining us. Have yourself a blessed evening. Stay prayed up and loving yourself. And don't forget, tomorrow morning when you wake up and before you go to bed this evening, please, I love me. Just say that. And when you put your children to bed, just remind them to say that to themselves also. Give them back their self-esteem and their self-confidence and let them be better human beings. So, our words, hope and love. Never give up hope. Never give up, period. And whatever you do, try to do it with love. Sometimes you can't because your temper is boiling at the minute. Address that anger. Don't act as if you're cute and you can't get angry. Jesus got angry. Remember? He went into that church and turned those tables over when they were gambling. So, you are allowed to get angry and you don't need fixing. Everybody wants to fix everybody. You don't need fixing. You just need to love yourself. Give yourself some self-love and help. And move into a better place of green and come out of the depressed state of blue. That's what you need to do. I promise you, you can do it. If you can't do it by yourself, start reading your Bible. Start reading the Psalms. There's one. I think it's Psalm 32 that talks about weeping may last for a night, but joy comes in the morning. And God will turn your mourning into dancing. Those are the things you need to read and uplift yourself. Stop moping and groping and blaming other people for where you're not or where you want to be and you think someone is holding you back. You are holding back yourself. Remember what I read about Gandhi. It's not about fixing the world. It's about fixing yourself. Once again, thank you so much for joining me inside the Diana Wright Show from around the world and in the United States. I say au revoir, adios, and ciao. Boom,